Hello everyone, this is Vamshi Krishna. So today onwards, I'm going to take a classes on YouTube. So many people are asking me to take the classes. So thank you for everyone. So let's enter into the topics. The first question is communication is communication is option A, sharing of messages between two people. Option B, non-verbal actions. Option C, verbal talk. Option D, all of the above. So if you see the all options, the right one is the option D. Why? Because communication is nothing but interacting between two people. Okay. So here we are sharing the messages, and non-verbal communication is nothing but gestures or movements, hand movements, eye movements, all this, and verbal talk by the mouth. ఓకే, మనం నోటితోటి మాట్లాడే వాటిని వర్బల్. ఓకే, సో ద రైట్ వన్ ఇస్ ద ఆప్షన్ డి, ఆల్ ఆఫ్ ది అబౌవ్. ద సెకండ్ క్వశ్చన్ ఇస్ ద blood creatinine level increase in which condition? Okay, in the blood, the creatinine is the electrolyte which is increase. అంటే మన బ్లడ్లో క్రియాటిన్ లెవెల్ అనేది ఏ డిసీజ్ కండిషన్లో పెరుగుతుంది? ఆప్షన్ ఏ సికేడి. సికేడి నథింగ్ బట్ క్రానిక్ కిడ్నీ డిసీజ్. ఆప్షన్ బి సివిఏ, coronary vascular. Option B is the cerebrovascular accidents, nothing but it is brain stroke. Okay, brain stroke. Option C CAD, coronary artery disease, it is related to the heart. Option D, deep vein thrombosis. So what will happen here? The thrombosis nothing but formation of blood clot in the deep vein. Deep veins mostly common in the legs. Okay, so the right option is the CKD, chronic kidney disease. So in this condition we can observe the increased creatinine levels. The next one is a myopia is a option A nearsightedness, option B long-sightedness, option C both A and B, option D none of the above. The right one is a option A. Option A is a nearsightedness. So in this condition, that you can see the objects that near clearly but have the difficulty seeing in objects that are further away. So in this condition, the person can see the near objects, but the person cannot see the long distance objects. For example, road signs. Okay, so the person cannot see the long distance objects. The next question is a serious diabetes complications where the body produces excess blood acids that are nothing but ketones and fluid and electrolyte balance. Sorry, it is imbalance. The options are renal failure, option B diabetic ketoacidosis, option C increasing insulin in the blood, option D pancreatic cancer. So among these, which conditions we can see the increasing of ketone bodies and fluid and electrolyte imbalance in the blood? with the disease of diabetes. So diabetes nothing but it is a sugar disease. Okay, sugar disease nothing but it's a glucose. So what will happen in the diabetes when the person having the decreased insulin in the blood? So what will happen? There is a reason decreased insulin in the blood. What will happen? It's going to the unusage of the glucose in the blood. So it leads to the brain damage and other complications. So in these conditions, what will happen? In the diabetic ketoacidosis can be developed. Okay, so diabetic ketoacidosis is a complication of diabetes. The next one is a increased opacity of lens is called increased opacity of lens. So lens are nothing but eye lens. Okay, the lens are which is present in the eye. Option A, hyperopia. Option B, glaucoma. Option C, cataract. Option D, intact pupil. The right option is a cataract. Okay, so cataract is a condition. What will happen? The lens, okay, the lens opacity will be increased, so the person cannot see the objects. So it is like a cloudy appearance. అంటే మనుషులకి ఈ కండిషన్ వచ్చినప్పుడు ఏమవుతుందంటే ఆ ఒపేసిటీ అనేది ఇంక్రీజ్ అవ్వడం వల్ల కంటి ముందు మేఘాలు ఉన్నట్టు ఒకే ఆబ్జెక్ట్స్ అనేటివి క్లారిటీగా చూడలేకపోవటము, ఒక పొర అనేది వాటిని అడ్డుకుంటుంది. దాన్నే ఏమంటారంటే క్యాట్రాక్ట్. సో గ్లోకోమా ఈజ్ నథింగ్ బట్ ఇంక్రీజ్డ్ ocular pressure. Okay, increased ocular pressure is known as the glaucoma. The next question is overdosage of atropine. So when you give the overdosage of atropine to the patient, what will observe? Option A, confusion. Option B, delirium. Option C, hallucination. Option D, all of the above. The right one is option D, all of the above. We can see in the patient with overdosage of atropine. So firstly, what is the use of atropine medication? So atropine medication we can use in many conditions like poisoning such as organophosphorus, okay, and also carbonate insecticides. So in these conditions we can give the atropine injection to the patient. So it leads to it action on the heart to treat the bradycardia. Bradycardia nothing but slow heart rate. Okay, bradycardia is a decreased heart rate. So it will help to restore the normal heartbeat. The next question is alcohol withdrawal is a. So what do you think? Alcohol withdrawal. Option A, intake of alcohol. Option B, stoppage of alcohol intake. Option C, changing of alcohol one brand to another brand. Option D, over intake of alcohol. So what do you think? What do you mean by alcohol withdrawal? The right option is the stoppage of alcohol. Okay, when the person giving the break intake of alcohol, it leads to the alcohol withdrawal syndrome. The next question is the bluish coloration of nails. Okay, nails nothing but gorlu, veli gorlu. Bluish discoloration of the nails is a sign of option A, cyanosis. Option B, infiltration, option C necrosis, option D it is a normal thing. The right one is option A, cyanosis. When there is a decreased capillary circulation, what we can see, the blue is discoloration of the nails. So this sign mostly we can observe in the OT, operation theater, to check the blood circulation to the patient. The next question is what is the meaning of deja vu? Option A feeling of having already experienced the present situation. Option B, a happy feeling. Option C, losing of something that is nothing but ఏదో ఒకటి పోగొట్టుకోవడం. ఆప్షన్ డి, ఏ ఫీలింగ్ ఆఫ్ లైటెడ్నెస్, అంటే గాల్లో తేలిపోవడం. మనకు కొన్నిసార్లు అనిపిస్తుంది కదా, గాల్లో తేలినట్టుందే అని. సో ఆప్షన్ డి, ఏ ఫీలింగ్ ఆఫ్ lightedness. The right one is the option A feeling of having an already experienced present situation. అంటే ప్రజెంట్ మనం ఏ సిచ్యువేషన్లో అయితే ఉన్నామో ఆ సిచ్యువేషన్ అనేది మనం ఆల్రెడీ ఎక్స్పీరియన్స్ అవ్వడం. ఓకే, ఫర్ ఎగ్జాంపుల్ మీరు ఏదైనా సినిమాకి వెళ్తున్నారు. సో మీరు చేసే జర్నీ అనేది ఇంతకుముందు ఆల్రెడీ చేసినట్టు కానీ, ఓకే, ఏదన్నా హోటల్కి వెళ్తే ఈ హోటల్కి ఇంతకుముందే వచ్చినట్టు అనిపించడం. సో దాన్నే డెజావో అంటారు. ద నెక్స్ట్ క్వశ్చన్ ఈజ్ అబ్నార్మల్ గ్రోత్ ఆఫ్ సెల్ ఈజ్ నోన్ యాజ్. ఆప్షన్ ఏ అపప్టోసిస్, ఆప్షన్ బి నెక్రోసిస్, ఆప్షన్ సి హైపర్ప్లేజియా, ఆప్షన్ డి నియోప్లేజియా. The right one is option D, neoplasia. An abnormal growth of the cell, it leads to the this process is known as the neoplasia. It leads to the cancer cell formation. The next one is the computer system doesn't contains. సో ఇప్పుడు మనం డైలీ యూజ్ చేసే కంప్యూటర్లో ఏదైతే మనము చూడలేము. ఆప్షన్ ఏ మౌస్, ఆప్షన్ బి మానిటర్, ఆప్షన్ సి కీబోర్డ్, ఆప్షన్ డి సిమ్ కార్డ్. సో దీంట్లో మీకు చాలా ఎక్స్పీరియన్స్ ఉంటుంది కాబట్టి యూ కెన్ గివ్ ద కరెక్ట్ ఆన్సర్, దట్ ఈస్ ఆప్షన్ డి సిమ్ కార్డ్. సో సిమ్ కార్డ్ అనేది మన మొబైల్లోనే ఉంటుంది. కంప్యూటర్ సిస్టంలో సిమ్ కార్డ్స్ అనేటివి ఐ థింక్ ఉండకపోవచ్చు. ఓకే, ద రైట్ వన్ ఈజ్ ద సిమ్ కార్డ్. The next question is telepathy is a method of. So what is telepathy? Option A, care for the tribals. Tribals nothing but Girijanulu. Okay, the people who are living on the mountains, okay, in the forest. So we call them tribe. Option B, treatment of old ages. Option C, care of elderly women. Option D, all of the above. Sorry, this is wrong option. It is treatment by telephone. Okay, so telepathy is nothing but we are giving the treatment or care for the people who is not reachable for the హాస్పిటల్. ఫర్ ఎగ్జాంపుల్, ఒక డాక్టర్ ఒక ఏరియాలో ఉంటాడు, పేషెంట్ అనే క్లయింట్ ఆర్ పేషెంట్ అనేది ఇంకొక ఏరియాలో ఉంటారు. సో వాళ్ళిద్దరి మధ్యలో నర్స్ కమ్యూనికేటర్. ఓకే, సో ఇక్కడ డాక్టర్, ఇక్కడ పేషెంట్. సో ఈ పేషెంట్కి ఎలాంటి ప్రాబ్లమ్స్ ఏమన్నా ఉన్నా ఏం చేస్తారు, బై ద టెలికమ్యూనికేషన్, by the telepathy or telecommunication we can share the problems of the patient to the doctor. So he will give the interventions. So all this process can be managed by the nurse or the any person. So it is known as the telepathy. The next question is a nominal variable is a. So among these four options, which one is the nominal variable? Option A, name. Option B, gender. Option C, age. Option D, children. The right one is the option B, gender. So nominal is nothing but noun or name. Okay. So here we have the nominal variable, that is male and female. Okay. So this is the gender is the nominal variable. The next one is the research is the process of. Option A, finding problems. Option B, finding solutions for the problem. Option C, solving the problems. Option D, all of the above. So the right one is the all of the above. So research nothing but re. Okay, again search for the searching. So we can use the research for the finding problems. So we have to find the problems, okay, in the population or the community, in the college, education, health facilities, whatever it is. And option B, finding solutions for the problems. Option C, solving the problems. So research nothing but all of these. The next one is the nephrons communicate with. Okay, nephrons communicate with. Option A, Kupffer cells. Option B, phagocytes. Option D, blood. Option C, blood. Option D, neurons. So the right one is the option C, blood, because the nephrons which are present in the kidney. Okay, so here we can see the nephrons. So what is the function of nephrons? It is filtration of the blood. So it is directly communicate with the blood. Option C is the right answer. The next question is the epi means. So what is the meaning of epi? Option A, upper. Option B, lower. Option C, middle. Option D, lateral. The right one is a option A, upper. AP means upside. I mean, paina. For example, AP is here. Okay. Hypo is here. Upper and lower. AP. Hypo. So the right one is a upper. Option A. The next one is a NCD full form. Okay, what is the full form of NCD? Non-communicable diseases. So what are all the non-communicable diseases or disorders? That is hypertension, diabetes mellitus, okay, epilepsy, and some other diseases which we cannot transmit from one person to another person. Those are non-communicable diseases. So this is end of my class. After a long time I am taking this one. If it is there any mistakes, if you don't understand, in the next class I will improve. Thank you for everyone watching my video.